the resurgence of Ebola in Uganda and the DRC, with recorded cases of Mpox, cholera, meningitis, and other epidemics in Nigeria, is raising concerns among public health experts. This has resulted in a red alert issued by the Epidemiological Division of the Public Health Department on its medical personnel in order to tighten its disease surveillance system and minimize the impact of diseases within the Federal Capital Territory. Health correspondent Kemi Balogun has more details.
The outbreak of Ebola in Uganda and the DRC to increasing cases of the COVID-19 virus in China, many parts of the world continue to battle with disease outbreaks. Nigeria has had its own share in recent times, with the nation witnessing an increase in epidemics from last year.
It should be across the country.
This medical expert believes that it is only normal for the country to be witnessing several disease outbreaks at this time due to certain factors.
Taking the entire country down, the propensity of spreading to the entire country with the environmental hygiene and also with the immune status of the populace that are facing these emerging and re-emerging diseases.
There has been a reported resurgence of cases of Mpox, Lassa fever, cholera, meningitis, and other diseases. The Federal Capital Territory Administration has tightened its disease surveillance system in order to minimize its impact through putting its medical personnel on red alert.
In this part of the world, we are prone to so many diseases of public health importance, epidemiologically prone. We call them epidemically prone diseases. Notably among these diseases in this part of the country or the world, cerebrospinal meningitis, Lassa fever, which is technically also classified and called viral hemorrhagic fever, yellow fever, measles.
The director reveals that proactive measures will be necessary to forestall further spread of these diseases.
We are all on alert mode on most of these diseases I've told you, and they are grouped and referred to as diseases that are reported periodically, regularly, under the integrated disease surveillance and response.
Effective disease outbreak response has historically been challenging for the Nigerian health system, but with the nation's successful response in taming Ebola in 2014 and the COVID-19 pandemic, the response system appears to have improved in recent times. The emergence and re-emergence of infectious diseases require strategic responses and preparedness, which the FCT seems to have put in place in order to forestall further spread and impact. Kemi Balogun, TVC News, Abuja.